Assalamu alaikum. This is Jahangir and you are watching Medical and Nursing Lectures. Dear learners, our today's topic is steps to prevent medication errors. One of the most common hazards that every nurse must avoid in her work is administering the incorrect prescribed medication to patients in their care. The most frequent medicinal errors concern incorrect dosages in drugs, the strength or frequency of the medicine, or even the failure to administer medication entirely. So here are the steps to prevent medication errors. The first one among them is prepare medication for one person at a time. So if you have multiple patients in your ward or in your unit, so you have to prepare medication for one patient at a time. Follow the 6 rights of medication administration. For example, right medication, right patient, right route, right time, and right dosage. Be sure to read labels at least 3 times, comparing medication administration record (MAR) with label before administering the medication. Do not allow any other activity to interrupt administration of medication to a patient. So do not call to someone, and also do not attend the call of any of your colleague or someone else. You should not also be busy in the social media or in messaging. Double check all calculations and other high-risk medication administration process, e.g. patient control analgesia, and verify with another nurse. Some kind of medication, for example analgesia or inotropics or chronotropics, they need a calculation. So when you have done your calculations, verify that calculation with another senior staff nurse, so to ensure correct medication dosages and also to prevent any kind of error, because of your minute error you can take the life of your patient. Do not interpret illegible handwriting. Clarify with prescriber. Question unusually large or small doses, because if you increase minute quantity or decrease minute quantity of medication, so it can risk the life of a patient. Document all medications as soon as they are given. It also communicates that you have done your medications. When you have made an error, reflect on what went wrong and ask how you could have prevented the error. If you are hiding your error or you are not saying that error to your senior or your administration, so this kind of error can be happen again and again, and we have to prevent any kind of medication error. Evaluate the context or situation in which a medication error occurred. If you are overburdened, inform your head nurse or your manager that I cannot handle such kind of burden, so he will give you another staff nurse. Now, so it helps to determine if nurses have the necessary resources for safe medication administration. Attend in-service programs that focus on the medication commonly administered. So it will also boost up your knowledge and you will be aware of the new researches also. Ensure that you are well rested when caring for patients. Nurses make more errors when they are fatigued or when they are in stress. Involve and educate the patient when administering medications. Address patients' concern about medications before administering them. For example, concern about their appearance or side effects. Another example is if you are giving a medication which can cause constipation. So before the administration, you should inform the patient that this medication can cause constipation. So you should not worry about it. And if a medication causes diarrhea because of the increased motility of GIT tract, so you should also inform the patient. Follow established policies and procedures when using technology to administer medications. For example, automated medication dispensing systems and barcode scanning. Medication errors occur when nurses work around the technology. For example, override alerts without thinking about them. And if a medication machine is alarming, so all the nurses have to give attention to that. Thank you for watching. Please subscribe the channel and press the bell icon. If you have any question, so ask that in the comment box.